Hey folks, it's Spitz from Pixels and Pills at Digital Pharma East in Philly 2012. It's my pleasure to have with me Mr. Uri Goren, PR and Digital Media Manager with NEOPHARM. They're a pharmaceutical company out of Israel. So that adds an interesting mix to the blend here at Digital Pharma in terms of having an international pharma player. One thing that comes to mind for me is the regulatory environment within Israel, and I understand that it's got a European-style flavor, so there's no DTC advertising. It's direct-to-physician only. What does that entail for you in terms of your outreach, and how do you go about using some of the opportunities that have been shared here, such as social media, peer-to-peer, and the like?
So Israel is more like Europe in terms that we do mostly patient education and disease awareness campaigns. The digital arena is yet to be engaged really by Israeli pharma. We're still more in banner ads and brand.com style sites, but we're trying to get there. There is a lot of interest in the community. We're trying to find out how we can do it. Regulatory-wise, there are no specific guidelines for social media, so it's self-regulatory. But the guidelines are quite understandable from what we do in regular media. So we know what we can do and what we can't do, and we need to try. It's a trial and error thing. That's what's going on in Israel. Most of the global pharma are present, and they do some things. A few apps are out now. Israeli version of global apps that pharmaceutical companies have. Our HMOs and healthcare industry are very active. Our largest HMO has a Facebook page, has a Twitter feed. They're more engaged than we are because they give service. Pharma is a little bit backstage now.
Yeah, pharma is a little bit behind the times here as well, and we're all struggling to catch up. One thing I find particularly interesting is the last metrics that I've read in terms of digital engagement for Israelis is very high. Israelis tend to be one of the most wired people on the planet from a technological point of view in terms of smartphone adoption, computers, and internet. Israelis are almost at the top of the heap. That's in contrast to what you're describing as far as pharma within Israel taking part. Why do you think pharma within Israel has been fairly hesitant to up their digital game?
I think what we are missing is a lot of data because we don't do direct to patients, and we are unable to see the ROI. We don't have scripts that we can follow. We don't know what happens in the doctor's office. It's all in the HMOs. So it's very difficult to see if what you do is working. So that's a big block. And management is thinking, how can we see what we're doing is taking effect? But they're getting used to, you need to be out there because your patients are out there. That's the main driver now.
Absolutely. And here in the States, there's a fine line that's drawn between managed care and then the treatment providers. So there really isn't too much overlap. In terms of the Israeli legal environment, what's the relationship like between payers, managed care providers, and the pharma, at least in terms of disease education, messaging, preventative care, and the like?
First of all, Israel has universal coverage, and we have four HMOs or health funds that provide the service, and they get funded from the government. And each year, the government decides on which drugs to reimburse. Something like the English system, but different, a version of it. And we have a very good relationship with the HMOs. Some of the disease awareness and driving awareness is done together, especially in vaccines. They had a lot of shared interest to up the vaccine rates in flu and in HPV and also in other diseases. And some are, conflict of interest. They want to keep the prices down and stuff like that. The regular business rapport between a buyer and a seller. So,
absolutely, that's very interesting. And the analog between European and especially British regulatory and messaging is interesting. The British recently released some kind of guidance and some precautions for messaging through digital. Do you guys follow their lead in that sense too, and or do you kind of cut your own way when you can?
We have our own way. Our Ministry of Health has yet to publish any formal guidelines. So we look at what happens in other countries in Europe. We go to our vendors or our suppliers to understand what they're doing and how they're looking at it. But we need to find our own way. We have our own way of doing stuff, and we try to learn, but not to go overboard.
Absolutely. And if you're influenced in terms of messaging and communication to the Europeans and the British, is there any influence, kind of whiplash effect from the American pharmaceutical industry? Obviously, it's going through lots of changes. Pipelines are shrinking. Many of the blockbusters are going generic. And the American pharmaceutical industry at its core is going through kind of a seismic shift of transformation. How is that impacting the Israeli pharmaceutical market?
Israeli pharma market is very used to generics. We have very large generics companies from Israel that are leaders, are worldwide leaders, Teva especially. So we know what generic competition is. Sometimes it comes to Israel even faster than it comes in the United States or in Europe. So we know how to handle it. Because we have a universal coverage and a different way of reimbursement, and so it's a different kind of work. So the seismic change that American pharma is, we feel it, but it's not specific. We learn from it. We learn from what they're thinking and ways of doing business and ways of innovating and trying to get it into our system. But it's different kind of environment. So you kind of watch and learn because it's the United States, but it's not specifically relevant.
What's interesting to me is that it actually might be in reverse. We're looking at the future of America in terms of pharmaceutical sales and marketing. When we're looking at healthcare reform, we're looking at integration, we're looking at potential synergy with managed care and the like. So an increasing role of government within America seems to foreshadow, in a sense, what's already going on in Israel. So hearing you speak, I'm almost like, hey, American pharma, this might be an actual future model or closer to a future model than what we might even conceive of today.
If you go to a more government-oriented pharmaceutical, pharma and healthcare environment, you should look to Europe because they've been doing it for a long time. They've been doing a lot of stuff that you haven't been doing. Israel has about 99% EHRs. Our HMOs are leaders in EHR development and how to do it. And Israeli doctors have been having a computer on their desktop for about 12 or 13 years now. So we know a lot of stuff that you're now getting into, but it's in a different way, of course, and a different culture and a different thinking. In Israel, one HMO holds 50% of the patients. So when they decide to do something, it goes across the country. You have a lot of smaller and more local things, and it's hard to integrate.
Absolutely, but as we look to healthcare reform, that integration might be inevitable as well. And what's fascinating, again, high level of technological adoption, yet your pharma, even with the integration and even with the government subsidies, even with the embracing of generics, has a tough time kind of embracing some of the newer digital trends that are out there.
That's because of the same risks of going and managing adverse events and managing risks and off-label discussions. It's quite difficult, and you need to know how to do it. And also you report back to headquarters that are across the sea, and they have their own way of doing things, so it takes time. Thanks
so much. It's Uri Goren, folks, from NEOPHARM out of Israel, pointing the way, in a sense, into the future of pharmaceuticals in general, and some opportunities and continued challenges within the space. This is Spitz at Digital Pharma East in Philly 2012, signing out.